Hello, I'm Dr. Terry Simpson. Today I'm going to talk to you a little bit about medical marijuana, something that I have changed my mind about over the last few years. Changed my mind about because of anecdotes from patients who have talked to me, but mostly because of hard studies in science that have shown things, like the recent study that came out showing that in the 17 states that have allowed medical marijuana by 2013, there was a reduction in the number of prescriptions that doctors prescribed for narcotics for pain, for depression, for seizures, for anxiety, and psychosis. There was the fascinating study that came out that was done in a test tube which showed that when THC was applied to some brain cells, there was a reduction in the amyloid production and inflammation, which is what we think is a cornerstone of Alzheimer's disease. Disease is very important to me since my mother suffers from a type of dementia, not Alzheimer's, but a different type. The DEA is currently looking at removing marijuana from Schedule 1 to Schedule 3. What does this mean? Schedule 1 drugs are drugs that the DEA says you shouldn't even do research on, there's no value on. And Schedule 3 is where doctors like me or your family doctor can potentially prescribe these drugs for patients. Even the most conservative Senator, Lindsey Graham, has changed his mind about medical marijuana and now endorses it. Pharmaceutical companies, a number of them, have opposed this. Perhaps it's because their number of prescriptions are dropping. I don't see any other reason. But let's be clear. I want research to be done about medical marijuana. I want us to take medical marijuana out of woo and into science. I want us to be able to identify the compounds that are active, where the efficacy is, where the dose is, where it will become effective, and where the dose is, where it will become toxic. I want to take out of the popular literature people who say marijuana can cure cancer. It can't. We can't keep going on desperate people who have cancer and saying this is a treatment. We need to bring medical marijuana into this century, purify it, determine its efficacy. It may be the one compound that can help stop our major epidemic of narcotic abuse in this country. We know that opioids or narcotics don't work for chronic pain. A patient with chronic pain simply gets two problems: opioid addiction and chronic pain. It may be that medical marijuana may hold the key. So I say let's bring it out of wool, let's bring it into science, let's study it, let's make it available widely. For your doctor's orders, I'm Dr. Terry Simpson.